what new therapies or research that's being developed give you optimism about the future care of MF?
Yeah, I mean, I think we are really in an exciting time for myelofibrosis, and that there are several drugs that have been investigated, are in the process of being investigated in kind of early phase studies and even some larger phase three studies. So there's a drug called pelabresib that's being looked at in the context of a phase three study with the JAK inhibitor ruxolitinib. So a phase three study previously demonstrated that patients had a significant reduction in spleen with using both drugs compared to ruxolitinib alone. And now there's another phase three study more focused on making sure patients feel better with the combination therapy, so a reduction in symptom score. There's a drug called imetelstat, which is being looked at in patients with relapse refractory myelofibrosis, so myelofibrosis that's already received some sort of previous treatment. And that study is looking at, do patients live longer when on that medicine, imetelstat, versus other standard myelofibrosis therapies. And then we have a number of kind of earlier in development drugs that are targeting some different pathways that we previously have not targeted in myelofibrosis. So one such example is a drug called nuvisertib, which acts on a pathway called PIM kinase. And that drug is being looked at both alone and in combination with JAK inhibitors, including a JAK inhibitor, momelotinib. Um, and I think it's an exciting time to figure out what these new drugs are that have promise, yes, but also what is the best JAK inhibitor to pair those drugs with. So historically, all of our pairings have always been with ruxolitinib because that's the JAK inhibitor that we've had for the longest amount of time. But now that we have these other JAK inhibitors that may not impact blood counts in terms of knocking them down in the same sort of way with drugs like momelotinib and pacritinib. You have a drug in fedratinib that continues to be very active for patients, even that have already been on a JAK inhibitor previously. I think as a clinical trial community, we're really asking the question, what is the best JAK inhibitor to pair a specific drug with, recognizing that a one size fits all approach probably is not the way to kind of make breakthroughs for our patients with myelofibrosis.